Spinal deformity is a really broad term used to talk about diseases of the spine that lead to deformity, to having changes in the posture. When most patients think about spinal deformity, or most lay people think about spinal deformity, they immediately think to kids with scoliosis. But in fact, more adults are inflicted with pathology related to spinal deformity, either as a result of the degenerative process. So over time, because of having asymmetric degeneration, they've developed curvature of the spine, such as a scoliosis, or even worse, being pitched forward, having a kyphosis and a global sagittal alignment problem, meaning that their head is no longer over their pelvis, over their feet. And so spinal deformity can really affect adults' quality of life. And so those are the patients that we treat here, patients with adult spinal deformity, patients that have lost the ability to stand comfortably without pain because of deformity, that their posture and balance is off. Well, there's lots of patients that have spinal deformity. The question is whether or not spinal deformity is the main problem or is just a component of the overall picture. And so it's very different between a patient who has pain going down their leg because of a disc herniation or because of narrowing of where the nerve is coming out of the spine that also has some degree of spinal curvature, but they are able to compensate. Their head is over their pelvis, over their feet, versus somebody who is no longer able to compensate for their spinal deformity. And so when we're talking about treatment of patients with spinal deformity, if we could offer something minimal or a minimally invasive approach to just addressing a nerve root compression problem or a stenosis problem and not necessarily need to treat the overall deformity, that might be great. Or in some patients, they need the overall deformity treated, and that's maybe a bigger type of operation. We know when it's right to treat a deformity when patients have exhausted all of the non-operative care, that their pain and quality of life has gotten to the point where it's very difficult for them to go through their everyday without having much in the way of pain. And so no one should have deformity surgery right off the bat. People should try non-operative strategies to see if their symptoms can be controlled. But if they cannot, then deformity surgery is right for them. I'm Dr. Joshua Heller. My mission at Jefferson is to improve lives.